Welcome to the office.
Marquis, welcome to the office.
Glad to be here.
What brings you here from North Carolina?
Just lower back issues, like in the sacrum, lumbar area, and then also in the thoracic region too.
Okay.
So it's just those issues. Like anytime I'm doing physical activity, it'll hurt. It'll kind of like, if it gets really bad, it'll start kind of like burning and stuff. So
When did it start?
it started around late 2017.
Okay.
Yeah. So this has been going on for a while.
You were in school?
Yeah, I was in school.
What
I was in 10th.
10th grade?
10th grade.
Okay. What did you play?
I played basketball, but
Okay.
because of this, like I just stopped.
Did you injure during basketball?
It wasn't during basketball.
When did you injure it?
So I've been to other doctors and they've said, it was like, okay, so have you had a childhood injury or something? And I was like, nah, I can recall it. But it was this one time, it was the summer of 2015. I was in the Bouncy house. And so my cousin, she fell on me, it was on my low back. And I remember when I fell, I was like, ugh, like that. Like I literally went like that. If you ever seen Dragon Ball Z, it was when it was like when Cell hit elbowed Vegeta's back, and I literally did that. Like it was crazy.
Okay.
So that was the only time that I can really think of like an injury I could have sustained.
Fair enough. Okay.
And then 2 years after that, that's when pain started.
That's when all this started. And it started as local low back
Yeah,
pain?
low back.
And did it go down the legs?
When it got super bad, like sometimes it would go down
Left side, right side, both?
both of the times. Sometimes it would be at the same time. Sometimes it would be one leg. So
And this started in 2017?
2017.
It's 2023.
Yep.
And that's the only childhood so-called injury you recall?
Yeah, the only one that was like really recent where I'm like, okay, it did hurt when it happened, so this might be it. So,
Okay. Any car accidents?
no.
Good. You drive?
Yeah, I drove.
Okay, just making sure. All right, jokes aside, let's get to work. Let's go over your x-rays. Let's figure out what's going on, what I see, okay? After we go over the x-rays, we will do the exam, figure out where we're gonna start today.
No.
And we'll see you through the week and figure out and get some answers. Okay?
No.
All right, let's do this. This is looking at you from behind. This is the right side. This is the left side. As we said, 24 bones in the spine that move, 23 discs in between. This is the foundation of your 24-story building. This is your side profile. Looking at you from the side, we're designed to have 60-degree reciprocating curves. First thing is, I don't see enough curvature in your spine. So what ends up happening as a consequence is the lowest lumbar takes up all the forces of gravity on the L5 disc. Now, first thing we want to do here is let's run a plumb line and see how your overall posture is. And the first piece of good news is your posture is decent with what you have. Okay, so this line here goes through L5, should bisect C7 and C2. C2 is slightly anterior to the line, but overall it's pretty good, pretty decent. I'm happy with that. But I do want a little more curve, especially if we get more curve here, then you'll develop more curve in the mid-back. Your neck is good. It's a little bit straighter. That's posture stuff that we'll talk about later, okay? And we'll come back to this going over your discs in a minute. We want to go over your foundation. When we look at this x-ray, this is your A to P looking at you from behind. Now, there is some curvature stuff going on there. Fair enough? You already know that. My business isn't here to try to straighten out a spine on this x-ray. My business is, do we have a level foundation, number one, and do we have the right side curves? That's number two. Okay, so let's go a little deeper now. Let's get some answers as to why this is all happening. And we also need to talk about his digestion. Okay, so first thing we can see is what? It's pretty clear. We have a short leg on the right. You have your short leg goes to the right, but your hip turns to the left. So your pelvis, your foundation wants to go left, but your short leg brings it back each time. So I know you got that North Carolina wiggle when you walk. I know you do.
Definitely.
Okay. Now, because of the weight distribution or uneven leg length, you're putting actually more weight on this right side. So the right side hip is wearing out a little bit faster than the left, and you're too young for that. So the biggest answer we're going to get is, did anyone tell you about a heel lift or that?
Yeah, one of the chiropractors I went to, they said to wear it, but I'd have to do it like every time. But it was just like they just gave it to me.
But yeah,
just to
you wear it?
Nah.
Did you bring it?
No, I didn't bring it.
Why?
I just
All right, so I'm going to be a little more serious then, okay? I have to be a little more serious, and it's that important. But let's get to the numbers and see what it means, and it'll make sense. Okay, so here's what's going on. You have a 9 millimeter. Well, there's good news here, actually. And maybe I'm actually glad you didn't wear it. I'll tell you why. You got me on that one. You have a 9 millimeter measure deficiency. Right side is 9 millimeters lower than the left. And we have a rotated sacrum and pelvis on the opposite side. Here's the good news. If we can correct your pelvis, 9 becomes 6. And as long as it's under 7, adjustments will hold. You don't need a lift. This is good. Now, when we look at if it is the left side that is the issue, let's explain this. So your left pelvis, I'm referencing the left because the sacrum is rotated on that side, okay? The pelvis works in opposite. If whatever I'm saying to the left is opposite on the right. The left pelvis goes up 1. It's internally rotated. It turns in on the back side. The sacrum goes back with it. So the overall effect is your body wants to go to the left. Your hip wants to bring it back to the right. And that's the imbalance. Does that make sense?
Yeah, it definitely does.
Okay. From there, Dad, does that make sense?
Yes.
Okay. From there, so the first issue is the foundation. Second issue is L5. Okay? And L5 is tilted on the left. It's causing more of this curvature issue here. Let's go back to this full spine. So it curves to the right, comes back to the left. Curves to the right, goes to the left. Curves to the right. So this is all compensation. Your body's going through a lot of compensatory mechanisms. Now, when we get to the upper back here, T1, 2, 3, T4. T3 is a side slip. T3, you had another, whether it was basketball or whatever, something happened there. You can feel that, I'm pretty sure. So T3 is a major sacrum. Now let's get over to the discs over here and see. So here's the good news, and you brought me the MRI, and it does show that the L5 and L4 are slightly compressed. If we look at the shape of the discs, they are a little bit less in size, but you still have good discs there, okay? The thing is, though, that whatever's happening in this foundation, you're not getting the movement through the whole spine, so the body is compensating, okay? And so 1 is the compensation, 2 is not having the curve, so this L5 disc is taking all the slack. That's why it's wearing out, so to speak, faster, okay? We want to see level discs. You see how that's a nice level parallel disc. We don't have it at 5, we don't have it at 4, we don't have it at 3, 2, 1, 12, none of them here. So what that tells me is this is all compensating. The issue's not coming from here. L5 we're going to have to work on, but that's not your fix. Okay? When we look at your tailbone, this is smooth. We got maybe potentially something here. Maybe at S2, S3, maybe something there. But definitely the pelvis is off, and definitely you have a rotated sacrum. So we need to figure out where we're going to start today, okay? Does that make sense so far?
It does.
Dad, you clear?
Yes, sir.
All right. As we go up the spine, look. So all of this is compensating all the way to here, dude. 5, 4, 3, 2, 1, 12, 11, 10, 9. So everything from his, all this is all compensating to this and this. So we don't need to mess with this. At least not on this visit. All right? We get to the thoracic spine, they're nice and level, level. Then bam, it starts to open up right there. 1, 2, 3, 4, 5, around T5. Okay, then we get to the neck. Your discs are good. We are starting to get a little bit of the reversal. You on the phone a lot or computer?
Both.
So let's look here at the neck. Okay, so we don't have the smooth forward curve. Let's go ahead and look at the flexion extension to see if we have any answers there. In extension, you have a beautiful curve, but that's not life, right? And in flexion, these all kind of move forward. You have a disconnect there. You crack your neck a lot?
Yeah.
You crack it, don't you? You're a self-cracker, aren't you? All right. They look okay to me. Meaning they're moving forward. If anything, C2 may be stuck a little bit, and we may have something in the upper cervical. I don't see good movement in the upper cervical complex. So I see the tailbone, I see the left pelvis, I see something potentially upper cervical, T3, T5, and L5. Those are the majors that I see going on here, okay?
All right.
Any questions so far?
No questions. Definitely understand what's going on.
Dad, are we clear?
Yeah, the only question I would have is as far as his pelvis.
Let's go back to it.
Yeah, how would that affect any type of, like, any nerves or anything like that?
Fantastic question.
Yeah.
Fantastic question. Let's put it up. So Dr. Gonstead was actually, this method we use, he was the first to talk about the pelvis. Before him, it was actually illegal to touch the pelvis. You know that? And they said the pelvis doesn't move. Now, let me rewind a little bit though, because you do have something that definitely happened in your L5. If I look at the shape of the disc, it's about 10 years ago though, okay? 10 to 12 years ago. So this wasn't 2017, it was before whatever it was. But how the pelvis affects it is very simple. Again, your first floor is off, but your basement is off. And the foundation of the building is off, so it's doing this. This is the left side. It's turning in, right? Up and in, and then the sacrum comes back, and then the whole thing is tilted that way. How is that first floor going to hold anything? It's not. Does that make sense? Neurologically, there are parasympathetic nerves that can be affected by a pelvic misalignment. I've had headache cases fixed with a pelvis adjustment. Okay, sciatica fixed with a pelvis adjustment where it wasn't the L5, S1. Anything can cause, but in his case, it's the foundation that needs to be level for the first floor, that L5 to hold. And on your MRI, what you brought me was someone who was laying on his back. Now, watch this, okay? When you're laying on your back for an MRI, the stuck joint doesn't move. The hypermobile segment moves and becomes more posterior because it's loose. Does that make sense? So we get a lot of false positives. Now, I send out to a seated or standing MRI. I'm not saying that there isn't stuff there. That's not what I'm saying. But when someone brings me that, and I'm seeing all of them are like that, with the foundation, we would start on the foundation, get it set, make it hold, and then we can set the L5. Okay? Does that make sense?
It does.
Okay. Does that answer your question, Dad? Okay. All right, shall we get started?
Yep.
Let's do this. Now, what we're going to do, let's watch. We want to check out the movement of his pelvis. The dimple should go up and down like that. Go ahead and walk to the corner of the room and back. Normal walk. Normal walk. You can see that right dimple is way lower than the left side. And this is your walk?
Yes, ma'am.
Dad, is this his walk? All right. All right, we got to put some groove in that walk. You take bigger steps? Or does it hurt?
No, it doesn't.
Can you take longer strides?
Okay.
See, now you can see the imbalance when he takes longer strides. So he hides it with a short stride. Okay, have a seat. Let's get started. Showtime. Starting at the base of the neck. And first thing we're getting is 25 points. Upper cervical, C1 occiput. Anyone touch you up top here?
Yeah.
It looks like you got a lot of little stuff going on. You had a lot of adjustments then, I'm assuming, yeah?
Yeah, definitely.
So, I don't know what's going to be different about mine.
Let's find out.
Let's find out. All right, good. I like it. He's not gonna fluff it up. I like it. 10 points, T5, T6. Is down in the low, S2, S3. S3 me. Now, if it was 5, Dad, come here, I'll show you. Sit up straight. Check it out. If it was 5 is here, I would get a very sharp break at 5 if that was the main cause right now. And what I'm getting is lower, S3, down low. If I found it there, then I would actually agree, yes, 5 is the cause.
Right.
Doesn't mean 5 isn't contributory, but it's not the original cause. Make sense? Now, let's go ahead and check his pelvis, feet together. Scoot forward a little bit. Open and close. You can watch. You can watch. Open and close the knees. Open and close. I'm checking movement of the SI joints. Do the right side only. And the left stays put. Good. Hold on. Left side only. Interesting. Okay, this is a right pelvis. Got it. Okay, the left is fine. So while I listed the left as a ASIN, it's actually the PIEX on the right. Tender here.
Yeah.
Tender at the bottom. Not as much.
Right. That one.
That's a PI. That says PIEX. EX is major. Of course you're gonna make me work. I love it. On a Monday afternoon, sit up straight. That's how I need him sitting. That's his normal posture. Back slowly towards me. That's 5. Tender?
Not really.
But that's your herniated disc. It should be tender.
Yeah, I ain't feel it at all.
S1.
Kind of feel that one.
S2.
Less than 1.
S3.
Yeah, I feel that.
S4.
Yeah, I feel that on the left.
Yeah. S5.
I still feel it.
S4.
Yeah, that's the
Or
worst.
S5. S4.
Yeah, S4.
S4, right pelvis. You see that, Dad? Mm-hmm. Let's continue. Static palpation, running my finger. This is all swelling, dude. Sit up straight. See that? We need that forward. We need that forward. Head down, please. So starting here, that's where all the edema starts, all that. That's all swelling inflammation.
He went through a phase where he was doing a lot of pull-ups with a pull-up bar.
Okay, that's
I guess he
fine.
was trying to, strengthen
Bulk
the
up?
body. Yeah.
Tender there
Not so much.
or there.
That was a little bit more, but
That one or that one.
I said that one, like the top one a little bit more.
But this one more.
Yeah.
That one. 1, 2, 3, 4, 5. 5, S4, right pelvis. And let's check up in the penthouse. Sit back for me, please. Glasses off, sir.
The
So what did you like doing before all this back pain?
I like working out, basketball, like you said, pull-ups, just trying to get stronger.
What about school?
Oh, I was in school?
Yeah,
Yeah, I was in community college studying entrepreneurship.
it's right there, dude.
I feel that one.
Yeah, that's the occiput. Huh.
But I taught depending on what we.
That thing ain't moving, dude. That's moving. Okay, head down. You sure you didn't drop him on the head?
Sure did.
Alright.
Sure did.
Alright, I'm just saying. Jokes, guys, jokes.
That left side is sinking.
Not so bad there though, right?
It's not really right, that left side.
Alright, let's make a game plan for today. We're not cracking a bunch of things just to crack and make sound. Sit up straight, please. So here's my game plan. We're gonna do S4 first.
Okay.
Occiput S4, have you walk. See what changes. I'm gonna adjust sacrum in a way to try to bring some of that side up. Actually, let me rewind. I'm not going to torque it to bring it up because if I do, it'll actually drop down the opposite side. So I'm going to start on the tailbone down low, then we're hopefully gonna get to that pelvis today too.
Okay.
Okay? Everything is different because in this office, because you guys are traveling patients. So I have to kind of modify a lot of the protocols that we talked about at one of the last seminars. I don't have the luxury of time with a lot of patients, you know, but we're gonna have to figure out follow-up too, because this ain't all getting fixed in a week, but we're gonna try to stabilize as much as we can. Are we clear?
I'm clear.
All right. Let's start on your occiput and your S4. Sit back here for me, please. All right. All right, scoot your butt back a little more. Right hand up, we gotta strap you in. Your dad's here though, sir. Dang. All right. All right, you good with that?
I'm good.
All right, shoulders back. Chin back, hands on your lap. Just let it relax all the way, please. I gotta be a little firm with him on the occiput. I'm just going through the motion. So we gotta bring it that way. There it is, that way, like that. Hold that. Give it a second. How you doing?
Doing good.
I'm doing good. Nod the head on the right, nod on the left. Stand up, let's walk it off, please. So this is just an occiput adjustment. Let's go face down on the gray table, please, over here. All right. Shasha! Hi.
Hi, Dr. Rahim.
Can you help?
Of course.
2, 3, 4. S4. Relax the shoulders, sir. Good. Oh.
Definitely gonna be feeling that one.
That was deep.
I feel it.
I need some WD-40 on my table. That was nice. Good for you too?
Yeah, that was
Yeah.
crazy.
That was deep. Walk it out. Check it out.
I also felt it on the left side too.
Turn around. Let me just open up the back. Take a step forward. This is after sacrum occiput. Walk it off, please. As you're walking, tell me if anything is different right now, please.
I would say like in the area you adjusted, it feels smoother, like silk.
Keep walking. Keep going. Now let's go ahead and re-scope, make sure everything is clear, and then we'll decide if we're going to start on the pelvis today or not. Those both set really nice, dude. Did that sacrum move like that before?
No, like that really feels strong. Cause I've had some pretty powerful adjustments, but that one was crazy.
I'm not a big guy, dude. Neck is clear. That cleared your mid back. Good choice, Rahim. I crack jokes, I pop bottles, I set bones.
More spitting.
All clear. Scoot forward, please. First thing, sit up straight. And first thing, let's just check the S4. Back towards me, check it out. 5, 1, 2. Different.
Different.
3,
It's less pain.
4.
Yeah, it's definitely like the last one.
Now let's check the pelvis. Sit up straight. You remember what that felt like?
Yeah, I feel like a more pinching feeling. It just felt harder.
I'm pushing harder.
Yeah, it's slight, but nothing like before.
It's there, but it's not like
Yeah,
before.
that's like before.
All right, we're gonna do this. Let's see, let's think about this. So we set this forward. Come over here so you can see my hand, not you. So if this is a PL, okay, and I set it S4 slightly on the left to bring it forward. If I go to close this, I have to be mindful we don't pull that one back then. Go right side down, let me see what I feel. Let's see if we can just lightly start the process. EX, now we're not doing it as a push because 2 reasons. 1, the EX is the major. 2 is the concavity or the convexity is on the left side at that point. Go on your shoulder, please. There you go. Nice and easy there, dude. There we go. Roll as a unit. Up on your shoulder some more, please. Good. Now I'm going to roll him towards me. And I'm going to do a slight little EX. EX, slight. Just to push. You okay on the shoulder there?
I'm good.
Butter, baby. Gotcha. Come on up. Walk it out. Oh! Nice. Turn. Let me just tuck this in. First thing you're going to see is the swelling is a lot less. It's tighter now. And we've got a little more movement in this dimple. You good there?
I'm good.
Have a seat. Let's recheck the movement. Is this you sitting normal?
Yeah, it's my like default sit.
Don't move. Check it out. That's a whole lot better. And we have something to compare it to.
Yeah.
Okay. Remember this thing was sticking out. We'll push it forward. Okay. Come back towards me, please. Different, yeah?
Yeah. Less and less and less pain.
Cool. Ears. That was for Dad. Shoulders. Let me do it. Let me have it. Let me have it. On your back, please. Let's work on the ankles. Cool. I don't think you got your sacrum moved like that. That's why nothing was holding. But
Yeah. No, I'm saying I've received powerful adjustments, but that one, like, no BS. Like, that was actually the most powerful.
Good thing I did my workout this week. Jokes aside, your homework is very simple while you're here. Water walking and ice. Shasha's going to give you some enzymes for inflammation. It's a pineapple-based enzyme to reduce the inflammation. We can go deeper.
Okay.
Once the sacrum holds, I focus more on the pelvis with that L5.
Right.
I'm hoping I can do the L5 by tomorrow. And that all depends on S1, 2, 3, 4 being nice and not tender.
Okay.
Makes
And how
sense?
many steps? How many steps should I take?
10,000 steps a day. Stand up, let's walk it out one last time. 10,000 steps a day is the goal. Dad, you're going to work remotely?
Yeah, I'm actually on board, so.
Just making sure. Squeeze the hand, sir. Easy, Tiger. Easy, Tiger. We got a lot of people now. Just a nice little squeeze. Relax there. Elbow. Lunate.
Definitely need that one.
Lunate. Scarf. Thumb. Squeeze. There you go. Questions for today?
No questions.
We're clear?
Yeah, good.
Welcome to the office.
Glad to be here.